the sleep clinic. Please take a seat. Okay. Have you ever visited the sleep clinic before? No? Okay. So what I'm going to do today is I'm going to ask you a couple of personal questions just about yourself and your sleep schedule. And then I'm going to be creating a personalised sleep pack for you, and that will be some products and some tips and tricks to help you make the most of your sleep. Okay, does that sound good? Yeah, okay. So before we move on to the sleep analysis form, please could I just get some basic information about yourself? Okay, great. So I'd just like your first and last name, please. Joanna Smith, yes. Great, and could I get your date of birth or just your birth year? Okay. 1978. Perfect, thank you. Could I ask your general occupation? The reason that we ask the industry somebody works in is just because, how you are on your feet during the day, or, if you're sitting at a desk and you're slouching, all of these things can affect your posture and therefore how well you sleep. Okay, oh, you work in IT. Okay, thank you. That's great. Okay, thank you so much. Okay, so we're now going to move on to the sleep analysis. I'm just going to ask you a couple of questions just about how you sleep, and that way I can personalise the sleep pack to your needs. So on average, could I ask you, how many hours do you feel you sleep? Yeah, per night, yeah. Okay, about 6 hours. And on the weekends, do you ever have a lie-in? Do you ever sleep in past your normal waking time? No. So no sleep transfer. Okay. And could I ask, do you have any young children or any young dependents? Three young children. Lovely. Below the age of 8. Wow, that's a handful. Go you. And you know how sometimes we wiggle around in our sleep? Are you able to tell me the side that you sleep on? Do you sleep on your back, your right side, your left side, your front, for the majority of the time? Left side. That's great. Okay, and how many times do you wake up per night, would you say? About 5 times, oh gosh, okay. Okay, and how many times would you say you wake up without cause? So, for example, without the children waking you up, without your husband waking you up with his snoring, for example. 1 to 2 times, are you pausing? And do you find that sometimes you've been worried about something or stressed before you've woken up? Yeah. Okay. So on stressful days, okay. So it's almost like your mind is still racing, yeah. Okay, so do you have a history of snoring? Yeah. And does anyone else in your family have a history of snoring? Okay. Okay. Yeah. very useful. Thank you. Okay, so I'm just going to ask you some brief questions about your medical history, but again, there's no pressure to answer these if you don't want to. So the first thing I wanted to ask is, have you ever been diagnosed with sleep apnea? Mm-hmm. Yeah. Okay. But your dad has. Okay. Mm-hmm. Okay, and have you ever been formally diagnosed with insomnia? Okay. Yeah. Okay, and lastly, have you ever been diagnosed with sleep paralysis? No. Okay, that's great, thank you. And one last question. Are you going through any life changes at the moment? Is there anything significant happening in your life? Mm-hmm. Oh, you have a newborn. Oh, congratulations. Oh, that's fantastic. 8 months. Okay. Yeah. Oh, yeah, of course. Okay. Yeah, it's difficult for any new parent, especially when you've already got very young children. Okay, fantastic. So I'm just going to process that. And I'm going to see what the suggestions are for your sleep plan. Okay. So, your custom sleep plan recommends that you use support pillows. So these are pillows which retain their shape, but they're still very comfortable. So they're not necessarily memory foam. They're usually simple cotton or duck feather pillows, but they are somewhat full. Yeah, and the thread count is quite thick as well, but it's thin enough to be airy. Yeah, so for pillows, I'm going to recommend support pillow times 2. So we're going to want 2 of those, and hopefully that should keep your neck as stable as possible, basically. I'm also going to suggest that they are hypoallergenic, especially as you did mention, sometimes having some sinus pain. Yeah. And in terms of sprays, these are things like essential oils, which I would recommend you spraying on your pillow and also adding into your humidifier at night time. And these are simply going to just help you relax at the end of the day. And the brand I would recommend is called This Works. And I would recommend at minimum a pillow spray, just because that's where your head goes, and so you're going to be breathing it in throughout the night. I would recommend one with lavender, and that's going to help you not just stay asleep, but also just feel as relaxed as you can before you get to sleep. As you mentioned, you might have a difficult time with the baby, and your mind might be racing before you go to bed, so it's important to spray the pillow spray on the pillow and kind of sit there and try and get ready for bed. No screen time, simply just sitting in bed and relaxing and possibly doing some deep or some box breathing exercises. Okay. And also maybe sometimes if the air is dry, based on your note you have a meter next to your bed, I would recommend simply misting the area around your bed. This is just going to help to help you breathe a little bit better during the colder winters, because you're adding humidity into the air, and therefore this will help you snore a little bit less, and it might alleviate any symptoms of sleep apnea that you might be having, even though you don't formally have sleep apnea. So I would definitely recommend that. And I would also recommend using a white noise machine. And if you don't have a white noise machine, a white noise ASMR video on YouTube will be absolutely fine. Make sure you find one that's about like 5 to 8 hours, okay? Yeah, they're very good. They are a selection of waves, so basically it's sort of polyphonic. It's lots and lots of different noises at the same time, and this kind of like forms a new noise, if that makes sense. And the reason that the brain likes the sound of white noise is a couple of reasons. So the first one is that white noise is comforting, and it reminds you of being inside the womb, because that's what you could hear when you were inside the womb. And then the other reason is because white noise can basically block out harsh frequencies that you might hear, and so that's why a lot of people fall asleep with the sound of a fan in the background, or the AC, for example, because it blocks out harsh sounds that you might find around your room. Even sounds of people walking around near the bedroom, or doors opening and closing. It's much easier for your brain to shut it off, so I would highly recommend that. A white noise machine is going to be slightly better, but if you can't afford it, just using a YouTube video is totally fine, and it's gonna do a great job. Yeah, exactly. So I'm gonna put the white noise video and then also misting slightly. Now the last thing I'm going to recommend, so this is extras. So when I was asking you earlier about how often you might wake up in the middle of the night and how stressed out you are, for example, I did notice that you mentioned sometimes being quite cold at night, and also waking up for no reason at all, but you know that the pattern is that you went to sleep and you were feeling stressed out. Is that right? Yes, yeah. So I would recommend a Liviva electric blanket, okay? So this is going to be included in your sleep pack, which you paid for earlier today, so you don't have to worry about extra costs. Liviva electric blanket is just going to keep you warm throughout the night, and you can put it on a different timers and different intervals. However, it's also weighted. Now the weighted blanket combined with the heat aspect, it's going to keep you warm and cozy when your temperature drops at night. So usually when you sleep, your internal temperature drops quite a lot. So that means that you can wake up with the shivers sometimes. So this is going to keep you warm inside and outside, and the weighted effect of the blanket is going to help you feel safe and secure, and hopefully it's going to prevent you from wriggling in your sleep. Now the reason that this is important is because sometimes if you're sleeping on your side at the beginning of the night, and then you fall backwards, you end up sleeping on your back. This is what can trigger snoring, because you're blocking the And last but not least, I will recommend some snore prevention. Now, we're gonna try one later. It's simply just a sticky elastic band that you will put on the top of your nose. You'll just place it there, and it lifts the airways to allow more oxygen to come in. Now, the reason I would recommend a snore prevention, such as breathe right, is simply because even though I know snoring is not your key concern, it really just helps you to breathe fluidly throughout the night and consistently, and then this can help you stay asleep as long as possible. So hopefully it might not just increase the sleep quality that you're having, but also help you stay asleep and reduce those random wake-ups that you're getting. Okay, so now that we've done this, I'm going to go and prepare your sleep pack, and I'm going to meet you back here in the evening. Okay, bye. So, it's time to get you ready for bed. Now, the first thing we're going to do is we're going to mist the room slightly. Now, the reason we're going to do this is because it will add some moisture to the air. This will help you sleep and to breathe clearly, more smoothly, especially in the cold nights we have at the moment. There we go. So, the first thing I got for you are these gorgeous support pillows from the White Company. They're soft, smooth, but they're structured enough to support your head while you sleep. And this is going to help you breathe clearly, stop any blockages, and help to prevent sleep apnea during the night. This hopefully should then alleviate some snoring and help you stay in one position while you sleep too. So I'm just going to open them up now. Okay, I'm just going to zip it back up. Now I'm just going to fluff them up for you. Ready. As you can see, these are really soft, really structurally sound. They retain their shape and plump them a little bit. And it's largely due to their 233 red count. They are 100% cotton. Now, for decoration, I bought you this gorgeous satin tent maker pillow. It's got these really beautiful, almost Victorian-esque flower designs on the front. This is somewhat of a bolster pillow. It's a little bit smaller than the bolster pillow you have at the back. This is largely for decoration, but also to keep you supported while you're sitting up in bed, on your phone, while you're reading, for example. I also have this really pretty flower pillow, which you said was your style. And this again is just for decoration, to bring it all together. It's also very comfortable. If you're working from home and you want to use this behind your back, it's very, very supportive. Definitely recommend it. Now, last but not least, you can see that the blanket you're using is actually a heated blanket. These heated blankets are very cost effective, and on the lowest setting, only cost about 3 pence an hour to use. They can keep you warm all night long and have numerous timers, so you can keep them on throughout the night or in intervals, for example. This is what I'm hoping will help keep you asleep and stop you from waking up in the middle of the night while your temperature drops, and hopefully it will keep you asleep the entire night. Because sometimes when your internal temperature drops and the external temperature drops, you can wake up, you can be more prone to waking up. So, there we go. Now for you, I have brought you a couple of things. So firstly I have some of your favourite snacks. We have some seaweed, some gummies, so you can have a little snack before you go to sleep. And I also brought you some Breathe Rights, which I've opened for you here. So I'll help you put one on. Okay. I'm just going to put it on you now. Okay. Perfect. Now, we use Breathe Rights because if you're prone to sinus infections, you might have a buildup of fluid around your cheeks and around your nostrils, and this can block you from breathing properly throughout the night. So I want you to wear these during the night for about 8 to 10 hours, and in the mornings you take them off. Simply put a warm flannel against your nose and it will come right off. What it will do is it will just open up your airways and help you breathe slightly better. Okay, perfect. Okay, so enjoy your snacks. And the last thing I'm going to do is I'm going to spray the pillows with this gorgeous jasmine pillow spray. It has jasmine and lavender, and hopefully that's going to get you feeling a little bit sleepy. Stress Check Sleep Spray, and this is from This Works, which is a fantastic company. you get snuggled and ready for bed, I have a stress check roll-up. And I'm just going to apply this to your chin, your neck area, and just to your arms. Okay. So one moment. Let me just come around here. Okay. Amazing. Thank you for doing that. So that's it. You're ready for bed. It's time to put on your pajamas and get cozy and snuggled